Hello. Today I want to talk about holotropic breathwork and mood disorders. And I want to draw a clear line, delineate the situations where holotropic breathwork, the usage of holotropic breathwork may not be indicated or may be contraindicated, and the situations where actually can be exquisitely helpful and one of the very few things that can be applied effectively. There's a difference between using holotropic breathwork for a short period of time, for let's say weekend workshop. It's very useful for some situations, but not for major psychiatric disorders. Holotropic breathwork in such situations should be, in our experience at least, part of systematic work. You will know the patient before the sessions. You will have possibility of proper integration. In other words, the use is actually holotropic breathwork supported or facilitated psychotherapy. So let me start with a brief summary. Holotropic breathwork was developed at the time when psychedelics stopped being available legally during early 1970s. It was developed by Stan Grof and Christina Grof as a new tool for self-exploration, as an alternative tool for accessing non-ordinary states of consciousness. And for some of you in the audience who may not know enough about holotropic breathwork, it's a technique that utilizes a combination of guided relaxation, speeded up breathing, and evocative music. And this combination brings people into non-ordinary states that can be utilized for self-exploration, or, as I'm going to show, also for treatment. Now, you probably know, if you follow literature, that mood disorders such as mental depressions are frequent but often non-responsive to traditional ways of treating it with psychotherapy, medication, or combination. At least 40% of patients either do not respond or do not respond sufficiently. Now, when that happens, or when the underlying sources of distress are situated very early in life, very early in childhood, or have transpersonal roots, then holotropic breathwork can be especially effective. And I'll try to illustrate it on a few examples. Well, when you deal with major mood disorders with holotropic breathwork, then it does require some special considerations, and I will outline that a bit. These considerations are careful initial assessment of mood disorder, special skills, special broader skills of the facilitators, availability of lasting support for the integration of the sessions. And in our experience, it's been particularly holotropic breathwork facilitated or supported psychotherapy that was very helpful and effective. Now, that's the summary. Let me now get into actual presentation. So, as I briefly alluded to, the holotropic breathwork was developed as a replacement to psychedelics for self-exploration. And people, of course, get into self-exploration for a variety of reasons. Often it's some distress that's caused by problems in relationship or psychological development or spiritual development, relationships with romantic partner, problems at work. Help with talk therapy by counselor, psychotherapist may be appropriate, or one can effectively use holotropic breathwork in those situations. However, when the distress, when we deal with real mood disorders, major mood disorders that markedly disrupt personal life, professional life, relationship in the family, then holotropic breathwork can often be uniquely helpful and appropriate to use. What complicates the situation is that mood disorders are clearly on the increase. The incidence, their presence is much more common now. World Health Organization keeps track of these things and statistics, and they point out to gradual significant increase in depression, anxiety, addiction in particular. Now, what further complicates the situation that often these conditions, and certainly depressions and mood disorders, do not achieve good results with traditional treatment. As I said, probably 40% of depressions either do not get well or do not get sufficiently well. And so that is a problem. You can, of course, use holotropic breathwork then, particularly in situations where the traditional treatments have not succeeded. However, that requires really shifting the strategy and getting deeper into the psychological makeup and use the potential of healing properties of non-ordinary states of consciousness, the properties of inner healer. What is not appreciated, unfortunately, is that there's a variety of mood disorders. And when you study these conditions over the years, longitudinally, it becomes very clear that there are distinctly different types of mood disorders, and to benefit, they require different strategies and different approaches. And because some of you may not be familiar with these clinical states, I'm going to show you, for example, the different presentations of depressions, even during bipolar disorder. You will see that the first patient will focus very much on the distress in her mood and moods, feeling sadness, low mood, despair. There can be suicidal thoughts, and there are some other associated symptoms, particularly sleep problems, anxiety. That's a kind of depression that you usually find described in the textbooks or in the disorders have been described for 100 years. The second patient is different. His experience of depression is particularly through inability to have enough energy, have enough interest, have enough motivation. And those things, and of course, that influences also his thinking and makes it very foggy and difficult. The third example I want to show you is a patient where the her moods actually fluctuate very quickly up and down, even during the day, even several times. Depressed, elevated mood, and normal mood, alternating. And there are a variety of moods, not just low mood, but at times she can be actually quite angry. Often she is very anxious, phobic, or might have some other issues. And these patients more often also get involved with drugs and alcohol addictions. So let me see if I can start that way.
Feelings are difficult to put in words. What is your depression like? What does it feel like?
I feel sad. I feel sad a lot of the time. I feel sad when I wake up. I can't get out of bed. And it just seems to go on for so long. I cry, and I can't stop crying. I worry. I worry about things that I really shouldn't be worrying about. And this has been going on for so long now. Sometimes I feel a little better in the evening, but only for a short period. I go to bed, I don't have any trouble falling asleep. I can fall asleep fine, but I wake up and it just starts all over again. I don't want to face the world. I don't want to get out of bed. I'm just really tired.
Could you tell me what the experience of depression is like for you? You know, in your own words. What does it feel like inside?
I can't get out of bed. Sometimes I feel paralyzed. I can't even roll over sometimes in my bed to get out. And you're fighting. It's like you're walking through quicksand, and you're trying to motivate yourself. And finally, when I get going, and the fog is kind of just lifting, I begin to feel good. I feel like I can finally fly, I can move, and everything is clear. But then, for some reason, I feel angry, and I feel frustrated at the world. Maybe sometimes it's because I think it'll all start again the next day, and the next day. And
how about your thinking?
Fog, slow and foggy and frustrating. And sometimes it feels like my mind is just going to stop.
How are you actually feeling inside? What are the feelings of depression for you?
That's really hard to describe for me because my feelings seem to be all over the place. Most of the time I feel anxious and frightened. I have frightening panic attacks. And sometimes they're so bad that I actually think of, escaping it all, ending my life. And other times I feel anger, frustration, But I can go to work. Sometimes at work I feel happy. I engage in conversation with my colleagues, and it actually feels good. But then, maybe an hour later I feel this emptiness again, and I can't concentrate. I feel scattered. I can't organize myself. So my colleagues might not even know, but inside I feel emptiness.
So let me go back now to the topic. I hope you saw clearly the different types of depression, and yet and in the DSM book, they will all come diagnosed as depressive condition without differentiating the very clear qualitative differences and the implications for what helps. Now, holotropic breathwork can be helpful in many mood disorders, but it's especially effective when the underlying sources of distress hide deeply. In the childhood, they are either early childhood or perinatal time, or in transpersonal domain. And I'll show you examples of situations that cover each of those situations. I hope you understand that the names and some personal details that could identify the person are altered. Otherwise, all the important clinical, psychological facts are there. Now, Ray is an example of a client who actually did remember the traumatic experiences in childhood and tried to deal with them in psycho and pharmacotherapy, but unsuccessfully. I think because it was just kind of memory, but he did not re-experience them fully, because these conditions are safe not only in the mind, but in the cells of the body, particularly the emotions, and that needs to be abreacted. And also, he did not realize how these early childhood experiences influenced his life choices and how they led to the dissatisfaction. So, Ray, he was referred to us by his GP. He was in his 50s. He was employed by the government of Canada as a senior economist, very stable position, quite successful in that, recognized by colleagues, but chronically unhappy, chronically dysphoric. And often his low mood turned into a clinical depression, and for that he had treatments, clinical depression with suicidal ideation. And so he had years of intensive psychotherapy. He had years of intensive pharmacotherapy, no impact. He talked about the difficult childhood and physical emotional abuse by his father, but that did not make any change. So when he came to us after the initial treatment and assessment, comprehensive assessment, he was offered holotropic breathwork. And initially, in the first sessions, he started experiencing a lot of the physical and emotional distress, emotional abuse by his father, how he was beaten and not appreciated, never felt loved or cared for by his father. And as he was re-experiencing them fully, not just in his mind, but also in his body, in his tissues, he gradually realized that his inner life had a very intense visual aspect, visual dimensions, and that he kept searching since childhood for some artistic expression of it. and that he was deeply dissatisfied with his life because he became an economist to please his father, not to satisfy his artistic and creative desires and feelings, and that his creative aspirations that were strong were fully suppressed by following his father's desires. He clearly did not address the childhood dream to become a visual artist. And so he continued in his daily life, dwelling on the painful memories, dwelling on the abuse. And that was sitting on that prevented positive resolution. That was a huge challenge for him when he started realizing the situation during holotropic breathwork, because it was a big decision, giving up the life of well-secured, well-paid government economist, senior economist, and going into very unsure, economically insecure job of artist starting at the age 50s. But as we continued with the holotropic breathwork, he realized fully the impact, and he did decide to go into artistic photography. I have to say that initially he was expressing pretty unusual images, but he found an accomplished mentor, not in Ottawa, but in Montreal. He studied with him to learn art photography, and gradually this transformed him from an unhappy, dissatisfied, frustrated economist blaming his father all the time for his unhappy childhood, led to him become a productive artist who expressed his profound feelings through dramatic visuals, initially quite disturbing, disruptive, but gradually learned to express both his negative, deeply negative, painful, and some of the positive feelings, and started finding some contentment. Depressive episodes stopped, and he became able, through the holotropic breathwork, to see the positive and negative aspects of life as two kind of inseparable components of life, and both clearly expressed in his art. So he went to the childhood memories, but went much deeper, when he just not talking about it, but re-experiencing the pain, the stress, and realizing fully then the connections with his life. The second is a story of Leah, and that's an example of a situation that occurred during the first year of life, or first months of life, that she had no conscious recollection. Now, she was an interesting lady, was married to a very significant gentleman in Ottawa. And when she came, she was 56 years old and suffered from recurrent depression since her childhood. Now, she had 12 years, I counted, 12 years of psychoanalysis, 3 years of other psychotherapies, 15 years of various antidepressants. The result of psychoanalysis was that it was sometimes difficult to get from her description of the symptoms, because she was giving them with kind of all this psychoanalytic interpretations right away, basis on, whether you use the word Oedipal or Electra, complex background. But that did not resolve anything for her. It did not reduce her resentment with her childhood, particularly resentment resentment towards her mother. And the depressions continued being periodically incapacitating. And of course, it didn't help that in the past she was given by other therapists no hope that she could possibly reach some satisfactory life, some balance. Now, when we initially did full assessment, comprehensive assessment, there was one more antidepressant, new one antidepressant. She didn't have it. We tried it, and again had no success. And during the psychotherapy, it was interesting how much negative thoughts she had, how much resentment and anger she had directed at her deceased mother. When woman in the late 50s, she had already 3 children, adult children, and yet she was trapped in memories of her childhood for some reason. I particularly remember one dream that was very typical, where she dreamt, keep in mind, this is a lady getting close to her 60s, 3 children, and here she dreams that she is adolescent, she has become pregnant, and absolutely frightened in the dream. What will mother say? Anyway, I think that was characteristic. So I should also mention that during the depressions, she often described some feelings of bars around her. And we were wondering whether maybe there are some, I don't know, past life or experiences, jail experiences, because she certainly did not have any criminal history. But it kept coming out, the images. So we offered holotropic breathwork. She happily accepted because of failure of everything else. And in the first 2 sessions actually, dealt primarily with the issues of her marriage. That was unhappy, unsatisfactory. They have not been intimate for many years, but she had an affair going with a family friend, and the friend was known to her father or her husband. He did not know about the affairs. And it was like a one night stand once a month for a number of years. She was unhappy. She was partly ashamed of that, but could not really stop herself. And this was replaying during the first 2 holotropic sessions, and a lot of scenes from unhappy childhood. In her 3rd session was different. She went right into first few months of her life. She was in the crib, and what she described very clearly were the bars of the crib in different colors, colored beams of wood. She started feeling intense terror, intense fright. And the feeling was, mother is coming, mother is coming. She expected that mother is coming and is going to punish her. Now, she certainly relived the terror with full awareness and in the body and anxiety associated with that memory. And then suddenly the music shifted in the session, and she experienced being in a large cathedral. And the the shift was really into deeply spiritual experience, beautiful singing, beautiful chorals, and she became, through this experience, aware of a deeper spiritual core of her that she really was not quite in touch with it. And clearly the blinds that she saw previously resembled the crib where she was lying down. Came out of the session, depression was gone. Now, we could not quite believe it. You know, coming from originally psychoanalytic tradition, I thought that she has to fully relive that experience to free herself. But no, the depressions were not coming down. We continued with holotropic breathwork. She had 4 more sessions based on the assumption that to free her of depression, she must fully relieve it. But not. The sessions were pleasant, fairly peaceful and relaxed, and she remained free of her depression. So we stopped the treatment. I continued seeing her every 3 months or so, just to make myself convinced that the result was there. For the next 12 years, she was completely free of her depressions. However, she did significant changes in her life. She stopped the affair. She gradually started rebuilding her marriage all the way to intimacy with her husband after about wait of a couple of years, and became more involved in spiritual activities, and lost track of her after 12 years when they moved to another city. Well, that's an example of a situation where the trauma or the source of the difficulty seems to be very early in the childhood, beyond the person's recollection. And the surprise for us was particularly that you don't need to fully relive this, somehow have to touch on the strangulated traumatic energy there for the people to have a relief. Well, the next is a story of Gladys, where it appears that the trauma was deeply in the transpersonal range. Of course, she had absolutely no idea. And as you will see, we did not have a good explanation how the treatment worked, but it did work. So this is a story of Gladys. Gladys was, since her adolescence, incapacitated by morning depressions. She woke up incapacitated, low mood, difficulty functioning, difficulty getting up. And eventually she came for holotropic breathwork, and this case is actually described by Stan in When the Impossible Happens, because it is a good example of that. In the first session of holotropic breathwork, she had she experienced various traumatic experiences from infancy and birth. She came out of the session with good feeling, but no noticeable relief. She woke up next morning, and the depression, the bad mood, incapacitated bad mood was there. In the second session, she went deeper, and she really started not only with childhood, but she went into reliving parts of her birth, and during the session had unusual activation of physical energy that seemed like a good sign that something might happen positive. She received eventually intense body work in order to relieve the energy that was stuck in her body and asking for expression. Again, no satisfactory resolution, but the next morning she woke up in one of the most severe morning depressions she's ever had. It's more pronounced. It was accompanied with agitation, anxiety that she could not tolerate well. And so the decision was made to change the plans and not to wait several days for another session, and started right the next morning. And so the idea was to do experiential work. She was asked to lie down in the middle of the group. The group created a circle around her. She was asked to do more activated breathing than previously, and to surrender to the flow of the music that was played, and asked to accept any experience as they come and deal with it. Well, it took quite a while, almost an hour, but she started moving quite violently, quite difficult moves with choking and coughing, and started making some loud noises. And it seemed like she was fighting some invisible enemies in that. And also, it appeared like she started relieving some difficult birth of hers in that birth-like position. Eventually, the screams became more articulate, more clear, and started resembling actually words, but words of that couldn't be understood, words but of an unknown language. So she was encouraged to proceed with that, and gradually the movements became more stylized, the words recognizable as words, but not having any meaning. So the group did not understand it and did not recognize the language. Then she began chanting, and it sounded like a prayer, chanting prayer, and repeating what looked like three different sentences, but the meaning was not clear. The impact of this was quite strong on the group, and although they didn't understand the words, they did not know what she was experiencing, but the participants felt deeply moved, some started to cry, some started to go into kind of prayer, meditative postures, joined hands for support. And when Gladys finally completed the chant, she was quiet on the floor and started, was on a horizontal position on her back, started looking blissful almost, motionless but blissful, and almost ecstatic expression. And she stayed that way for about an hour. And she came out, didn't understand what happened, but said that she had irresistible urge to follow what was happening. Now, interesting synchronicity, if you want to put it that way. There was one member of the group, Carlos, who was an Argentinian psychoanalyst from Buenos Aires. He was Jewish. Gladys had no Jewish connection, but he was Jewish, and he recognized that Gladys was actually chanting in perfect Sephardic language, Ladino, combination of medieval Spanish and Hebrew. Sephardic Jews lived in particular in southern Spain, and a huge, if you know the history, had a huge impact on developments there, because the Jews actually financially supported the Christian development. That there was at times there was actually the largest church in Europe that was Christian and paid by Jews, and so he recognized that she was actually talking this Sephardic language called Ladino, and he translated what Gladys was actually chanting. Turns out that she was chanting, "I am suffering and I will always suffer. I am crying and I will always cry. I am praying and I will always pray." This took her out of the depression, and the depression did not return for the whole period of follow-up. And of course, it's a mystery. I mean, the mechanism is a mystery. Is it a past life experience in the Sephardic Spain? Is it a connection with some collective unconscious that she simply linked to? Who knows? The important thing was she was well. So let me now move to when the holotropic breathwork is used in major mood disorders. As I said, for the weekend kind of sessions, this is not the approach one should use. But if one does use it, we certainly very much supported the idea of holotropic breathwork, supported psychotherapy or facilitated psychotherapy. And using holotropic breathwork in that situation, I think, requires caution and safety for the client, because you do not really know what you, in these major disorders, what you may open up in terms of positive or deeply negative energies and levels of consciousness. So we feel that it's important to carefully and comprehensively assess the patient. What kind of depression is it? What does it need? What are the symptoms? What is the history? What is the family history? What are the risks? The second thing is, I think one needs to have available facilitators that are well trained in holotropic breathwork and have some understanding of mood disorders as well. So broadly trained. And perhaps one of the most important things is to have an opportunity to provide very good integration and available as long as needed. This may not, the 6 or 8 hours session may not be enough, depending what you open. We were running the sessions in a house where the client and at least two facilitators could stay for 2-3 days, if necessary, to complete the work that was done. And I'd like to also stress that it's advantageous to do holotropic breathwork in a group, because the group support may be very important, particularly when you deal with somebody who goes so deeply into the unified field of consciousness. Well, let me just say briefly what is emerging, the new understanding. Now I have to say this is my way conceptualizing how the non-ordinary states of consciousness are actually acting. And these new insights come from what has, from the renaissance of psychedelics, because psychedelics made it possible to study these non-ordinary states through brain imaging. And it's been also possible to study major mood disorders with brain imaging. And the message, what this is about, is very much identical. And if I had to summarize it, it appears that these non-ordinary states of consciousness are a co-creation of what comes, the experiences, the richness, varied, deep, profound experiences coming from the unified field of consciousness, but the brain playing a role in this, playing a role in the predisposition, as certain people are more predisposed biologically. Brain plays a role in the intensity of experience and to some extent in timing, and you will see through the influences on neuronal oscillatory processes. If you have a chance, look at some of the observations of brain imaging on psychedelics, particularly psilocybin or LSD, how increased the interconnectedness of the mind becomes. Suddenly different parts of brain start working together. So you can have synesthesias. You can, for example, hear colors, or you can see sounds, you can see music, because suddenly these different parts of brain that are normally separate in function are joined. There is elevated neuronal oscillation. I'll show you example of that. And finally, the third clear element is that what is a brain filter, the default mode network, opens up. Normally it's closed or mostly closed, and that's associated with the experience of ego. Whereas here, if the brain filter opens up, you have access to the unified field of consciousness and gradually can feel egoless. And that, of course, has important therapeutic implications. Let me just show you the oscillatory processes. We all have in the center parts of the brain oscillation that is necessary. It's a complex system, and the stability, it's like a stock market. You maintain the stability by oscillations up and down. And it's these peaks of oscillation that are particularly prone to non-ordinary states of consciousness. So the scheme that I would use to explain what happens is that under ordinary circumstances, the brain oscillates within a certain range, below a certain threshold. But when you start getting into non-ordinary state, the oscillations overshoot. And if you have had some experiences with psychedelics, for example, you know how, for example, you're getting into the experience in oscillations. You get into it, out of it, more into it. And this is quite characteristic. And so the present concept as I see emerging is that non-ordinary states of consciousness are co-creations of the ordinary, of the unified state of consciousness, the non-local field of consciousness, and the neurovocal brain. Okay, here is a summary of what I said once more, and that is it for the presentation, and we can, of course, get into questions and hopefully answers.